Hello learners, we shall now continue with the water soluble vitamins and study their physiological role and benefits. Now, the next water soluble vitamins, after we have discussed vitamin C, thiamine, riboflavin and niacin, is pyridoxine, also referred to as vitamin B6. Now, vitamin B6 refers to a group of chemically similar compounds which can be interconverted in biological systems. Its active form, pyridoxal 5-phosphate, serves as a coenzyme in some 100 enzyme reactions in amino acid, glucose and lipid metabolism. Now, pyridoxal 5-phosphate is an essential component of enzymes that facilitate the biosynthesis of sphingolipids. Vitamin B6 is one of the B vitamins that benefit the central nervous system. It is involved in producing the neurotransmitters serotonin and norepinephrine and in forming myelin. Now, let us see the health benefits of vitamin B6 in relation to immune function. There is ample evidence to suggest that adequate vitamin B6 intake is important for optimal immune system function, especially in older individuals. Additional research is needed to evaluate whether vitamin B6 intakes higher than the current recommended dietary allowance could prevent or reverse immune system impairments. Role of vitamin B6 in cardiovascular diseases. The use of multivitamin supplements including vitamin B6 has been associated with a 24% lower risk of incidental coronary artery disease in a large prospective study of 80,000 women from the US Nurses Health Study cohort. More recent research has confirmed that low plasma pyridoxal 5-phosphate status is a risk factor for coronary artery diseases. Moderately elevated levels of homocysteine in the blood have been associated with increased risk for cardiovascular disease. 2 PLP dependent enzymes are required to convert homocysteine to the amino acid cysteine in homocysteine transsulfuration pathway. Thus, the amount of homocysteine in the blood may be influenced by nutritional status of at least 3 B vitamins, namely folate, vitamin B12 and vitamin B6. Now, coming to the role of vitamin B6 in inflammation, a growing body of evidence currently suggests that low vitamin B6 status may increase the risk of cardiovascular disease through mechanisms independent of homocysteine lowering. While inflammation may contribute to lower vitamin B6 status, current evidence fails to support a role for vitamin B6 in the control of inflammation in patients with cardiovascular disease. Role of B6 in cognitive decline and Alzheimer's disease. A few observational studies have linked cognitive decline and Alzheimer's disease in the elderly with inadequate status of folate, vitamin B12 and vitamin B6. Yet, the relation between B vitamins and cognitive health in aging is complicated both by the high prevalence of hyperhomocysteinemia and signs of systemic inflammation in elderly people. Vitamin B6 and depression. Coexisting symptoms of depression and low vitamin B6 status, plasma PLP level of less than 20 nanomoles per liter has been reported in a few cross-sectional studies suggesting the significant role of B6. B6 and cancer. Chronic inflammation that underlies most cancers may enhance vitamin B6 degradation. In addition, because PLP is required for methionine cycle, homocysteine catabolism and thymidylate synthesis, low vitamin B6 status might affect these pathways and potentially increase the risk for chronic conditions.
Let us now come to the next vitamin, that is cobalamin, also termed as vitamin B12. Vitamin B12 is a nutrient that helps to keep the body's nerve and blood cells healthy and helps make DNA the genetic material in cells. We now see the health benefits of vitamin B12 as related to cancer. Folate is required for synthesis of DNA. Decreased availability of folate results in strands of DNA that are more susceptible to damage. Vitamin B12 deficiency traps folate in a form that is unusable by the body for DNA synthesis. Thus, vitamin B12 deficiency may lead to an elevated rate of DNA damage and altered methylation of DNA, both of which are important risk factors for cancer. Cognitive decline, dementia, and Alzheimer's disease, and the role of vitamin B12. Occurrence of vitamin B12 deficiency in elderly population has been frequently associated with disease. One study reported lower vitamin B12 levels in cerebrospinal fluid of patients with Alzheimer's disease than in patients with other types of dementia, though blood levels of vitamin B12 did not differ. Other metabolic implications of vitamin B12 deficiency include the accumulation of homocysteine and methylmalonic acid, which might contribute to neuropathologic features of dementia.
Vitamin B12 and depression. Although it cannot be yet determined whether vitamin B12 deficiency plays a causal role in depression, it may be beneficial to screen for vitamin B12 deficiency in older individuals as a part of a medical evaluation for depression. Observational studies have found as many as 30% of patients hospitalized for depression are deficient in vitamin B12. Now, coming to folate, it is a water soluble B vitamin, also known as vitamin B9 or folacin. Folate is critical in the metabolism of nucleic acid precursors and several amino acids, as well as in methylation reactions. Folic acid helps the body to produce and maintain new cells and prevent DNA changes that may lead to cancer. Folates, especially in the form of methylfolate, are important to the nervous system at all ages, perhaps in parts related to numerous CNS methylation reactions. Neural tube defects in the fetus, inborn errors in childhood, and depression, cognitive impairment in elderly people are all areas of interest. Now, let us go to the health benefits of folate. Folate metabolism and neurodegenerative and neuropsychiatric diseases. Insufficient amounts of folate and vitamin B12 limit the conversion of homocysteine into methionine, which is a direct precursor of S-adenosyl methionine, that is SAM, which plays an important role in the methylation of neurotransmitters involved in depression. Lower concentration of this SAM and monoamine neurotransmitter metabolites were observed in the cerebrospinal fluid of severely depressed patients with high homocysteine levels compared to similar patients with normal homocysteine levels. According to epidemiological and biological evidence, depressive disorders among individuals with epilepsy or neurological and psychiatric problems in the elderly could be caused by low folate. Now, role of folate in cancer. Adequate intakes of folic acid appears protective against the initiation of carcinogenesis in healthy tissue. Several epidemiological studies have, however, suggested an inverse association between folate status and the risk of cancer, including colorectal, lung, pancreatic, esophageal, stomach, cervical, ovarian and breast cancers. However, research has not established the precise nature of folate's effect on carcinogenesis. Now, folate and its role in reproductive function. Maternal nutrition, especially folate, is critical for optimizing pregnancy outcomes. Inadequate folate intake before conception and early pregnancy increases the risk of congenital malformations of the brain and spinal cord, such as anencephaly. Now, this condition is a severe congenital condition in which a large part of the skull is absent along with the cerebral hemispheres of the brain. Then spina bifida, this is a congenital defect of the spine, and neural tube defects, that is neural tube defects, also referred to as NTDs. These are birth defects of brain, spine or spinal cord. Now, neural tube defects are the most common and severe congenital malformations of the central nervous system, and they are related to a deficiency of folate. Coming to the conclusion of this module on fat soluble and water soluble vitamins and their health benefits, we see that all vitamins are vital to carry out body functions, though they are required in very small quantities. Vitamins differ widely from each other in chemical structure and therefore in their biochemical functions. Vitamins are involved in a wide range of metabolic processes and serve as structural functions as well. The absence, rather the presence of vitamins has demonstrated their importance and specific functions. Vitamin deficiencies are reflected in decreased tissue and then serum levels of the vitamin, followed by a decrease in the related biochemical function, leading to clinical symptoms of the corresponding deficiency state. In addition to their known physiological roles of the vitamins, if present in adequate quantity in the diet, it not only prevents deficiency disease, but also protects the body's cells from oxidative damage, inflammation and degenerative diseases. Excess intake through supplements can have toxic effects and needs caution. Thank you.